Hello everyone, my name is Nupur Goyal and today I would like to present our research on nursing staff knowledge and attitudes regarding urinalysis practice in a geriatric inpatient setting. I'll begin with some background. Studies show that the elderly population are at an increased risk of carrying multi-resistant extended beta-lactamase producing bacteria where exposure to antibiotics is a contributory factor. Literature suggests that inappropriate urinalysis testing practices in nursing home settings may actually contribute to overdiagnosis of UTIs and consequently antibiotic overprescribing. Less is known about practices in a hospital setting, however. Now, urine dipsticks and urine culture testing are unable to distinguish between asymptomatic bacteria and a symptomatic UTI. Therefore, as the risk of asymptomatic bacteria increases with age, performing urinalysis in the absence of clinical symptoms in this population is most likely to detect asymptomatic bacteria rather than a true infection. Now, with our study, the aim was to explore nursing staff knowledge and understanding of urinalysis practice and interpretation in an elderly patient population. The intended benefits of the study were twofold. One, to understand the drivers for nurse-initiated urinalysis testing, and two, to explore knowledge of nursing staff regarding interpretation of urinalysis. And we were hoping that this would help us identify areas for enhanced nursing education and nursing stewardship. So we distributed a paper survey to nursing staff of geriatric subacute care hospital wards over four different hospital sites. Participation was voluntary and anonymous, and the survey included 5 multiple choice questions where more than one answer could be chosen. A total of 237 nurses were invited to participate in the survey, and we had a response rate of 60% with 141 nurses responding to it. Now, with the results on the left, I've got a table of indications that were correctly identified by nursing staff as signs and symptoms suggestive of UTI. And on the right side, I've got indications that were incorrectly identified as possibly suggestive of a UTI. I think the pertinent findings here are that 1, routine urinalysis on admission was standard of care in 7 out of 10 wards. And interestingly, routine testing in patients with indwelling catheters was recommended by 1/3 of the nursing staff. Acute urinary retention and lower abdominal pain were less recognized as signs and symptoms of a UTI, while on the other side, offensive urine was incorrectly identified by 100% of nursing staff as a sign suggestive of a UTI. Other signs and symptoms that were incorrectly recognized were vaginal itchiness, dark urine, and foamy urine. On the positive side, dysuria and new urinary incontinence were correctly identified by 100% of nursing staff as a positive sign of UTI. I think the other interesting thing to note here is that 60% of nursing staff said that they would do a urinalysis test at the request of a patient or family. I think some of the other key findings here is that the majority of nursing staff identified that urinalysis was an appropriate next investigation for patients with suspected UTI, and that only 30% of nursing staff were confident in interpreting all results of urinalysis. We've identified a few areas to target here. I think the first is the need for recognition of indications of testing, as well as understanding that testing as routine in asymptomatic patients, as well as routine testing in patients with indwelling catheters, actually might lead to unnecessary urine culture testing and subsequently unnecessary antibiotic prescribing. There's a need for recognition of asymptomatic bacteriuria and the fact that urine testing actually doesn't help us differentiate this from a true UTI. And I think there's also a role for education regarding limitations of urinalysis. Nursing stewardship has a critical role in ensuring strategies to optimize appropriateness of UTI testing and recognition of asymptomatic bacteriuria. And I think leading from all of this, we can identify potential strategies, including nursing education to recognize clinically appropriate indications for urinalysis, urine culture, and antibiotic treatment, as well as developing education for provision to patients and families. And this is an area that we'll start working on once the COVID climate settles. So thank you for listening in, and I'll see you at the conference.